Hi, I'm Mary Colbert. Welcome to Dr. Colbert's Divine Health Podcast.
And we're talking about the brain zone, Mary. This is part 3.
Part 3. There's so much information about the brain, Don. And you know what? That's the most important part of our message, is to give people hope that it's not a death disease anymore.
Mary, I've seen so many people over the years that they're older now, they're in their 70s, their 80s, and they're just resigned to being in a nursing home. And they've kind of checked out.
Not
and
me.
They're resigned to having dementia and they're becoming feeble and frail, and they've kind of checked out of life. We can prevent that. We can reverse that. And so that's what we're trying to get across to Christians. Yes, you have a choice to make. And now we want to continue on the dementogens, because dementogens are simply chemicals and other things like certain drugs like marijuana that can trigger dementia.
I think this is like one of the most important things, and I pray this video and this YouTube and Rumble that we're going to be on goes viral, because, Don, people need to really know this about this for themselves, their grandchildren, their children. Pot, marijuana is becoming legal everywhere. And that message, people think, well, if it's not legal, then okay, we shouldn't do it. But now it's legal, so it kind of sends the wrong message that, well, because it's legal, it can't be that bad.
Yeah, we're going to be talking about marijuana.
That couldn't be further from the truth.
But also, marijuana contains a heavy metal. Many times it contains lead. And so, again, we've talked about mercury, we've talked about arsenic, but I want to just add a few things about arsenic. There's 4 key toxic heavy metals that many of us consume every day in foods or in the water we drink. And so arsenic is actually in many of the water supplies contain arsenic. So to prevent that is you use reverse osmosis or filtered water. It's simple.
Or drink Fiji.
Yeah, Fiji. And again, there's no heavy metals in there.
Right.
And again, other ways we get arsenic is from the foods we eat. Realize that many of the cotton fields used to use an arsenic-based pesticide to get rid of the boll weevils. Well, these cotton fields have now been taken over, and they're growing other crops like rice or corn. And so the rice many times has higher amounts of arsenic, and especially it's concentrated in the brown rice syrup that's used to make many of the cereal bars. So, again, it literally concentrates the arsenic. So we find now that certain foods that are more prone to have more arsenic in them include rice, especially those grown on fields that used to have to be cotton fields. But you can get organic rice, and it's much less likely to have high arsenic. So remember, if you choose organic foods, it's much less likely to have arsenic. Dairy products can contain arsenic. Apple juice, grape juice, wine. I'll never forget a patient we did heavy metal testing routinely years ago, and this man had high arsenic levels. We traced it back to he drank wine every night. And when he analyzed his wine, it had high arsenic. And that's a common thing we see, is a lot of wines contain arsenic, as well as there's other foods that contain arsenic, or cheeses. And the best way to get rid of arsenic is to simply choose organic foods, use a reverse osmosis filter, and take a glutathione boosting supplement daily. That's what I do. There are many different ones that are good, like N-acetylcysteine is inexpensive, 500 milligrams twice a day, or Celgevity. I have a new nanonized glutathione spray I'm real excited about. This is the new nanotechnology, this 1/1 billionth of a particle size of regular glutathione. We can quantify it, so I'm real excited about this product. But glutathione is the master detoxifier, as well as infrared sauna. And for those with high levels now of arsenic or mercury or lead or cadmium, we can actually do chelation therapy. And I talk in the book about how to find a chelating doctor. You go to acam.org. And these are doctors trained in chelation. Majority of patients don't have to do that. They can use natural means to do it. The next heavy metal is lead. Now, it's interesting that lead, a food that many of us love, and I'm a lover of this, usually contains lead, and that's chocolate. And so
I love
chocolate and root vegetables, including potatoes, sweet potatoes, and carrots, typically contain lead. Also, greens like spinach and turnip greens. Any kind of green veggies, deep green veggies tend to take up lead. That's why the Prop 65 in California identifies foods, and most of your deep green veggies have some lead in them, not a toxic amount.
And we can't get away from this, so what do?
So we take glutathione,
Okay.
the master detoxifier that binds the excess lead. Any kind of chocolate will have minute amounts of lead in it. And so when you even flavor anything with chocolate, you're getting minute amounts of lead. So it's important to take a glutathione booster, be it N-acetylcysteine, Celgevity, or our new nano-nized glutathione, which I'm real excited about, which is part of our Divine Health products. Will help to bind it and get rid of it.
Now, the Celgevity is a company that is out of Utah.
Yes.
And they initially started as a multi-level or what do you call it? Not direct MLM or direct marketing company. But you now can go and call and get the product directly from them,
which is great.
So you
can go
Google
online.
and look online, and if you have to have someone refer, you can say Dr. Colbert is the one who told me about it. If they won't send it to you, tell him he said to send it to you.
The next heavy metal that we see commonly, routinely, that can cause memory loss, and that's what we're talking about. These 4 heavy metals, mercury is the worst, arsenic, lead, and cadmium can contribute to memory loss. And unfortunately, you find these in many of the water supplies. That's why it's important to drink filtered water, and in many of the foods we eat that we think are healthy foods. Well, one of the main sources of cadmium, the main source is cigarette smoking. And I had a lady back in the 1990s, I'll never forget this lady. She was diagnosed with Lou Gehrig's or ALS and came to see me. Well, I checked her heavy metals, and many people with Lou Gehrig's have heavy metals. And this lady, I just had another one with heavy metals. And this lady actually had, she had Lou Gehrig's due to high cadmium levels. I chelated her cadmium. And when I chelated her cadmium, all her symptoms of Lou Gehrig's went away. And her doctors, neurologists, came back and said, we misdiagnosed you, but all her symptoms went away. So what we find is cadmium is neurotoxic, and it's found mainly in tobacco, and this lady was a 2-pack-a-day smoker. Also, it's found in shellfish, crab, lobster, shrimp, liver, kidney, mushrooms, and chocolate, and the root crops, the sweet potatoes, and carrots. So cadmium is toxic to the body, but it's easy to get rid of. All you do is, again, use reverse osmosis filter, choose organic veggies. But again, what we will need to do is take our glutathione boosting supplements or infrared sauna. And if you have a lot of cadmium, like this lady who was diagnosed with Lou Gehrig's but turned out not to have it, we chelated her with calcium EDTA.
That was such an amazing story to see that, because after doing everything that you advised her to do, she came in a wheelchair, and now she's back teaching and everything. And
well, that was 25 years ago. Over 25 years ago, I've lost touch with this patient, but it was absolutely amazing. Now, another dementigen that we see commonly, Mary, but most doctors never recognize it, is environmental illness due to mold toxins.
That's an important factor right there,
and
mold.
Mold is toxic to about 25% of the world's population. They do not have the antibody that binds to the mold toxin and eliminates it from the body. And so about 25% of the population will have mold toxins and will have a condition called chronic inflammatory response syndrome.
What would be some of the symptoms if someone may have
mold toxins? I'll discuss this in detail in my book. But one of the main symptoms is they'll have vibration, usually up and down their spine.
Oh, wow.
Or they'll have, it feels like an ice pick going through their temples or their forehead.
Wow.
Or they'll have these weird kind of like MS symptoms where they'll have numbness and tingling throughout their body. And this is mold toxin. See, mold in 25% of the population, and it comes from water-damaged buildings, from hurricanes or leaks or sprinklers hitting the wall or leaks in a pipe, leaks in the roof, leaks in the ceiling, leaks in the HVAC system of the home. And this causes mold in the particle board, in the drywall. that literally outgasses mold toxins, and it creates a musty, moldy odor. And 25% of the population, they can get highly inflamed. It inflames the brain. And let me tell you a story about a patient I saw about 10 years ago. This lady came in, and she had early dementia, and she was in her mid-30s, and she had all these symptoms of mold toxins. I checked her, and her transforming growth factor and her C4A were extremely high. These are inflammatory markers. I discuss this in detail in my book, The Healthy Brain Zone. And we have in the back of the book what tests to order for your doctors to order, so you can have them order these. They were off the chart. And so I said, you've been exposed to mold toxins. I put her on a special air purifier that got rid of the mold toxin out of her air, but then I had her actually do mold remediation. I had her get out of her house, take her Air Oasis air filter with her, and then I started binding the mold toxins in her gut with a low dose of cholestyramine. You can use other things like Welchol to bind the mold toxins. And it was absolutely amazing. Once I got her out of that mold environment, once I got her air clean, once I bound these mold toxins, then her brain started turning on, and literally all her memory loss went away. But what happened a few years later, her son, or it's either a son or daughter, that was in middle school or high school, started developing the same problems.
Symptoms. Wow.
Inflammation, the same headaches, the same vibration up and down his spine. And so we said, let's check the school. And lo and behold, the school had mold in one of the classrooms. And so,
and this is a big concern with all the hurricanes that Florida has
yes,
had.
absolutely.
And water damages that people have suffered from freezes and pipes breaking and different parts of the country. Mold is going to be a huge issue in the future.
Mary, just like about 25% of us have the ApoE gene, the Alzheimer's gene, about 25% of us are sensitive to mold, and it can literally lead to Alzheimer's at early ages.
Wow.
And so many doctors miss it.
Wow.
It is critically important for you, if you're having memory loss, to see if you have these inflammatory markers, or to read this chapter on environmentally acquired illness, especially mold illness. It is absolutely inflammatory to the brain and causes the brain to degenerate by increasing the inflammation in the brain, which creates beta amyloid, and you're gumming up your brain and downsizing your brain when you have mold exposure. And it's an epidemic, and doctors are missing it.
Wow. The scriptures are very plain in the Old Testament about if a building is
That's
overtaken.
in Leviticus, right.
In Leviticus, that was one of the laws given, that if a building becomes overtaken in mold, burn it down. Take
the stones out of the city.
Stones apart and take them out of the city limits.
It's that toxic.
It's that toxic. That's how deadly mold is to human beings. So many do not have that ability to detox the mold.
Right, exactly.
Wow.
Now, Mary, one of the other key dementogens we see are anticholinergic drugs. Realize the main neurotransmitter for memory in the brain is acetylcholine. It's a neurotransmitter that helps our brain remember. And that's why the main drugs or medications used to treat Alzheimer's are anticholinesterase inhibitors that keep acetylcholine in the brain so that you can think more clearly. Now, we are being exposed to anticholinergic meds, and these meds are ubiquitous. And so many doctors prescribe them, and they're over the counter, and they're causing so many people to be pushed toward Alzheimer's by lowering the acetylcholine in the brain.
Wow.
And so we need to identify a few of these.
Okay.
And the research shows these meds may increase the risk of Alzheimer's disease.
Because they're inflaming the brain.
No, because they're lowering acetylcholine, the main memory neurotransmitter for the brain.
Okay.
These meds may increase the risk of Alzheimer's disease by more than 50%, especially in those meds that have been used for more than 3 years.
Wow.
Now, these meds are used, I see patients on these every day in my practice. The first anticholinergic med that we see are antihistamines, especially Benadryl or diphenhydramine or hydroxyzine or Atarax. These are anticholinergics. So for you that are taking Benadryl every night to sleep, you are potentially damaging your brain and pushing your brain toward Alzheimer's. The other class are for incontinence of urine. A lot of women are on ditropan or oxybutynin, and this is an anticholinergic med. Remember, when it's used for over 3 years, you're pushing your brain toward Alzheimer's by lowering your acetylcholine. Another is the antidepressant Paxil that is commonly used. Another class are your GI meds. Now, these are real common, so listen to these. Phenergan is used for nausea. That's an anticholinergic. Another is Imodium, used for for diarrhea. They take Imodium. Another is Lomodal. Another is Librax and Bentyl that are used for irritable bowel syndrome, which they're anticholinergics. They're pushing your brain toward Alzheimer's. Muscle relaxants will do this, such as Robaxin and Flexeril, which is methylcarbinol, and these are commonly used by people with muscle spasms or just that need a muscle relaxant. They're on Robaxin or methylcarbinol or Flexeril every day, and they're pushing their brains toward Alzheimer's. And the last is for vertigo. You know, when you're having vertigo and the room's spinning, they go to and they get Antivert or Meclizine. Well, this is long term. Short term's okay, but if you're on it long term, you're pushing your brain toward Alzheimer's because it's an anticholinergic. So just being aware of this, and you can actually protect your brain from Alzheimer's disease. Another one that we talk about is too much copper. Do you know 95% of homes in this country have copper piping? Yeah. But you know, when you run hot water through that copper piping, then you are literally leaching more copper out of the piping when you run hot water out. So it's important to get a reverse osmosis filter if you're drinking the water. But we don't do that in our house. We use a bottled water that doesn't have copper. Too much copper can actually push you toward Alzheimer's. And foods that are high in copper are chocolate, cashews, apples, asparagus, and avocados. Now, it's not a problem when you're young as long as you keep the correct copper-zinc ratio. As we age, our zinc levels get lower. When zinc levels go lower, copper levels generally go higher, and copper can become an oxidant to the brain and push us toward Alzheimer's disease. A lot of people take copper supplements. Do not take copper supplements, or else you're going to push your brain toward Alzheimer's. So again,
zinc. You
want to take zinc, and it's in our multivitamin. Our enhanced multivitamin from Divine Health has the zinc.
That's what I take every day.
And that'll help minimize your copper. And again, just the main thing we want to do is avoid drinking tap water because most homes have copper pipes, especially hot water. We have a hot water spigot on ours that you can make hot tea. I won't drink that because it leaches more copper out of those pipes. So that's what's really important to know. The next dementogens we want to talk about is NutraSweet or aspartame. Aspartame is NutraSweet. This is composed of aspartic acid, phenylalanine, methanol, which is methyl alcohol, and formaldehyde. About 10% of methanol is converted to formaldehyde, which is embalming fluid, which is toxic to your brain, especially your hippocampus. So I tell people, do not consume aspartame. It is toxic to your brain. Now you say, what about just a little? Again, a little may be okay, but is a little formaldehyde okay for your brain? No, none is good for your brain. Okay, the next dementogen, number 6, is alcohol, especially if you have the Alzheimer's gene, the ApoE4 gene. If you have it, avoid alcohol. If you don't have it, a little red wine is the best type, but again, small amounts. And that's only like 4 or 5 ounces a day, and that's it. Okay, or just I would do it even less than that if I were you. But I have the ApoE gene, so I choose not to drink alcohol. The next dementogen, number 7, are trans fats. Now, the U.S. banned trans fats back in 2015, but the way they did this law is if a processed food contains less than 500 milligrams of trans fats per serving, it's listed as 0 trans fats. So it's, again, your trans fats are ubiquitous in our diet. Those brownies, that cake icing is found in donuts, frosting, chips, cookies, crackers, French fries, margarine, microwave popcorn, non-dairy
everything
creamer.
I love.
Everything you love. You're partially hydrogenating your brain. That's 60 to 70% fat. Now listen to the study. This is in Japan. They found that those who consume more trans fats had a 50 to 70% higher risk of Alzheimer's or dementia later in life.
Wow.
So again, when you eat trans fats, you are inflaming your brain. Trans fats inflame the brain. They cause your brain to produce beta amyloid that is downsizing your brain. It's shutting off areas of your brain. It's gumming up your brain, and it's causing your brain to be pushed toward Alzheimer's disease. Number 8 is
Before
general.
you go into number 8, let me just stop and encourage people to get a hold of this book, Dr. Colbert's Healthy Brain Zone. We are not going to be able to cover everything in these podcasts of what's in this book. It's very simple. It's easy to read. He made it very simple and understandable so that you can follow it. It has recipes toward the book of things that you can eat. He and I eat out a lot, so I really have to follow this.
And I carry my own olive oil, too.
And he carries his own olive oil.
Yes.
Also, you can go in and take a look at our website, drcolbert.com, divinehealth.com, and you will see all of our products are there.
Especially the Brain Zone products.
He has formulated. And this is your diet you want to follow for life.
Beyond keto.
This is the anti-Alzheimer's or dementia diet that you would want to follow to reduce your chances and risk and improve your health. You know, good health doesn't just happen. You have to be deliberate about good health. And I can tell you, bad health is very, very expensive. It is very expensive. So having good health, prevention really isn't that expensive. So because of what you pay on the other end if you develop one of these diseases. So go on to our website. And what you do when you become a partner of Divine Health, on any of our products that you order on a monthly basis, you're enabling Dr. Colbert to do what he does, and that is to travel, go to these seminars, travel around the world. None of this is inexpensive. It's very, very expensive. But your partnership enables us to be able to do that, and we appreciate our Divine Health partners. So go to drcolbert.com, divinehealth.com. We're happy to introduce to you. I'm trying to get it so that it's your one-stop shop. If we don't have it, you don't need it. And that's my goal, is to get it to that point. So,
well, we're talking about dementogens. We've got to number 8. And
okay.
It's general anesthesia. When you have general anesthesia, you are literally stressing your brain. It's stress to the brain because the low oxygen, generally when you get the general anesthesia, it lowers your oxygen, it lowers your blood pressure, it increases stress chemicals in your body, which all can stress the brain. Mm-hmm. Now, again, this happened to my mom because she had, during the beginning of COVID, she fractured her hip. And she was in the hospital for about a month. And she had to undergo
really
surgery.
Caused her to plummet very
Oh, my
fast.
goodness. After her surgery, I saw her mental ability decrease dramatically.
It's true.
What we have learned for those that undergo surgery, if you have to have surgery, now again, we all may have to one day have general anesthesia, but one of the key nutrients, I keep talking about this nutrient over and over, it is the master detoxifier of the brain. It's glutathione. And if you're going to have surgery, I'll tell my patients, please get a glutathione booster, or I love our new nano glutathione, which is a spray. Just spray it in your mouth.
It's not there yet.
It'll be here within the next couple of weeks.
Yep.
It should be here.
Hopefully be here.
And that is our master detoxifier. Again, there's other types that people can get, such as N-acetylcysteine, 500 milligrams twice a day. I love Celgevity. I've used that for years. But the one I'm most excited about now is our new nano-sized glutathione spray.
And you just spray it once or twice a day?
2 sprays twice a day.
2 sprays? Wow. People can do that.
It's real
people
easy.
Are pill
and it's
fatigued.
Not that
They're
expensive.
tired of taking pills.
Yes.
So.
But now the other, number 9, dementogen, we got to talk about is marijuana. Because prior to 1990, marijuana, the THC content of marijuana was less than 2%, which was a smaller amount. Now, in 2017, popular strains of marijuana contained a THC content of 17 to 28%. But now we have many THC products are highly concentrated, such as THC oil dabs and THC oil gummies.
They
contain about 95% THC. And this THC can be very harmful to the brain. Studies have shown that long-term use, greater than 10 years, and heavy use, greater than 5 joints a day, resulted in bilateral reduced hippocampal volumes and significantly worse performance on verbal learning, the studies have shown. Now, the hippocampus is where we transfer short-term memories into long-term memories, and we consolidate our memories in the hippocampus. Literally, marijuana is like poison to the hippocampus of the brain, where you start to lose your short-term memory. So that's why these high THC concentrations that people are using are literally eventually will damage the hippocampus and will impair learning. Also, it pushes you towards schizophrenia. You never know if you have the genetic glitch where it could turn on schizophrenia, where you have this process, this horrible mental health illness the rest of your life, where you have to be on antipsychotic meds.
You know, mental illness is rampant right now.
Oh,
and
it
I
is.
really believe the undercurrent of this rampant, it's increased 100-fold across the world, is because of marijuana and street drugs.
Exactly. And
There's frying the brains
many drugs,
so
but marijuana is the one that is so much used, so much
easy
more
to
so
get,
used. Easy now.
very
And it's being
easy.
legalized. And
Yeah.
we're just seeing the tip of the iceberg. Now, the last dimension, since we're almost out of time, is chronic infections. Chronic infections include cold sores. Now they know that those with recurrent cold sores are more prone to dementia. Why?
Wow.
Cold sores increase inflammation in the brain, which starts to gum up the brain with beta amyloid. Chronic bronchitis, chronic sinusitis, chronic Lyme disease, any kind of chronic disease, chronic COVID, long COVID, literally increases inflammation in the brain. Any chronic infection can increase inflammation in the brain, which produces more beta amyloid and can damage your memory. So again, we got to keep inflammation down. What I do is I make this real simple. We teach you how to lower inflammation. How do you lower inflammation? It's so easy. Get an oil change. Clear the inflammation out with natural means. I'll talk in detail what to do. How do you lower inflammation from cold sores? L-lysine, 500 milligrams once a day or twice a day. If you have active cold sore, 500 milligrams twice a day. And with each disease, we have natural means to lower the inflammation, the infection, clear the disease from the body.
Because you don't want to carry on long-term illnesses and long-term inflammation.
Inflammation is poison to the brain. It's the cause of type 1 Alzheimer's. It's inflammatory. It's hot. Inflammation is hot. Inflammation creates beta amyloid. It gums the brain and downsizes the brain.
This is such good information. And Don could go on and on and on, I can tell you.
Well, we got to do another podcast. We're not through. I thought we'd
my
be through with
goodness.
3, so we're going to have to do a podcast 4.
Yeah, we'll have to do podcast 4 at a later date. But be sure and get this book and get the information and read it, underline it, mark in it. I'm telling you, this could literally change your life. It could improve your life in so many ways for your friends, your family, your children. You need to know, because what you don't know is killing you, and that is the truth. So become power and full of knowledge of the truth. That is what we're committed to, is bringing you the most current information up to date. Thank you for tuning in and listening to the Dr. Colbert's Divine Health Podcast. We are committed to bringing you the most current, up-to-date information, and we're going to try and work toward every disease known to man. And God has an answer. That's the important thing you need to know.
Amen.
He has an answer for everything. And it's our job and our commitment is to try to bring you what is truth. You shall know the truth. And that is what we're committed to. No matter what it is, we want to bring you the truth. Become a hungry person for truth. You know, a person who isn't hungry. You shall know the truth,
and the truth shall set you free.
It will. It'll set you free from not just in what you think, what you know, but it can free you from disease. Literally free you from disease. The truth, the difference between doing one thing and another will bring you into a place that walking in divine health, because that's God's desire. That is His. You need to know that first. The will of God is that you walk in divine health. It is not God's will. He does not teach you through disease, and He's not a child abuser. That is not who God is. He loves you. He wants good for you. He wants good for your family. We are up against an adversary, the evil devil, and he hates you and he hates me. But you know what? We magnify the Lord. We don't magnify the devil and what he's doing, because God is so much bigger, so much greater, so much answers that he wants to bring to you. Get a hold of this book and share it with your friends
Amen.
and your family and our products. Thank you for being a partner with Divine Health and enabling us to do what we do to bring good news to those who love him.
God bless you and walk in divine health. We'll see you next time.
Bye-bye.